Hi everyone, I am Dr. Michelle Chia, Medical Director at Ezra Clinic. Today, we will be discussing one of our signature procedures at Ezra Clinic, which is the Intra-Uterine Device or IUD procedure. So for a start, let's talk about what the IUD really is. The IUD stands for the Intra-Uterine Device. This is a form of birth control known as LARC, which is long-acting reversible contraception. So what this means is that the IUD can be safely used for a long period of time, but it is also not permanent, which allows the patient to easily reverse the birth control effect once she intends to start a family. IUDs can be used for up to 5 years and are one of the most effective ways of preventing pregnancy, with an efficacy of 99.8%. As its name suggests, the IUD involves having a small plastic T-shaped device that is placed inside the uterus. One of the reasons why the IUD is one of my favorite methods of contraception, and also one of the most popular methods amongst my patients, is because it's a set and forget type of treatment. What this means is that once the IUD is inserted, it sits in the uterus and prevents pregnancy effectively and does its job. You do not have to remember to take any pills or take any jabs, which makes it an extremely convenient method of contraception as well. Another reason why the IUD is so popular is that this procedure can be easily performed in the clinic via a fast and easy bedside procedure. There is no surgery or invasive procedure involved, and there is also minimum downtime involved. There are two main types of IUDs available in Singapore. A hormonal type of IUD, also known as the Mirena, which is the main hormonal IUD in Singapore, and a non-hormonal Copper IUD. The hormonal IUD contains a progesterone hormone that is slowly released into the uterus, while the Copper IUD does not have any hormones. The hormonal IUD is a soft plastic device that sits in the womb. It also contains the hormone levonorgestrel, a type of progesterone hormone. This helps to prevent pregnancy by inhibiting fertilization and implantation. Additionally, the hormonal IUD releases the progesterone hormone gradually and slowly into the womb. This also helps to prevent pregnancy by thinning the lining of the womb, making it unfavorable for pregnancy. This allows the hormonal IUD to be one of the most effective contraceptive methods with the lowest failure rates. The key difference between the two devices is the presence of hormones inside the hormonal IUD. The Copper device does not contain hormones, while the hormonal IUD does. Both IUD types can be used effectively for 5 years, and the insertion and removal process are similar. Another key difference are the expected effects or uses of the IUD. The hormonal IUD can also effectively treat other women's health conditions such as heavy menstrual bleeding, painful menstrual cramps, and endometriosis. One of the biggest perks of getting the IUD compared to other forms of birth control methods is how you can set it and forget it for the next 5 years. With the IUD inserted, you are 99.8% protected from pregnancy and do not have to worry about problems like missed pills, patches falling off, or missing your contraceptive injection appointment. The Copper IUD is also the only non-hormonal form of contraception available for women who are not suitable for hormonal contraception. It also releases copper ions, which are toxic to the sperm and makes the cervical mucus unfavorable. This inhibits and prevents the movement of sperm to the egg so that fertilization cannot occur after sexual intercourse. This makes it an extremely effective method of contraception. So here is a list of some of the benefits of an IUD and why you should consider it as your chosen form of birth control. Firstly, it is the most effective form of contraception available. It is 99.8% effective in preventing pregnancy, yet 100% reversible. The IUD is also minimally invasive compared to surgical tubal ligation. The procedure is convenient and fuss-free compared to other contraceptive options. And there is also the immediate return to fertility once the IUD is removed. The IUD can be safely used for up to 5 years, so you can be worry-free for the next 5 years. Additionally, the Copper IUD is the only non-hormonal, reliable form of long-term contraception option available. Last but not least, the Hormonal IUD can also effectively treat other women's health conditions such as heavy menstrual periods, painful periods, cramps, as well as endometriosis. So today, we will be debunking some of the myths found online about the IUD procedure. The IUD procedure is minimally invasive and does not require any surgery. An IUD can be performed easily and quickly in the clinic with no downtime. In experienced hands, the procedure should take no more than 15 minutes. The IUD can be used as a reliable form of contraception, even if the woman has never given birth before. Do consult with an experienced doctor if you have never given birth before and are keen to consider an IUD as a form of birth control. Having an IUD does not cause infertility. In fact, once the IUD is removed, the return of fertility is almost immediate and the couple can start trying to conceive right away. Once inserted, you should not be able to feel the IUD, so it is unlikely to affect your daily activities or sexual activities. In fact, having the IUD provides greater peace of mind that you are well protected against an unplanned pregnancy. If it is your first time getting the IUD fitted, it would be recommended to consider coming for a consultation first to find out more and understand more about the procedure, as well as allow us to perform an assessment to determine if you are a suitable candidate. I will then plan and advise you on the best time to plan the IUD insertion procedure after this. On the day of the IUD insertion, wear loose and comfortable clothing so that you will feel comfortable before and after the procedure. You may choose to take a painkiller before your appointment to reduce the pain and discomfort during the procedure. However, many patients also do fine without any painkillers. The procedure is done in the clinic and should take no longer than 15 minutes. During the procedure, you may experience slight discomfort that is similar to menstrual cramps. These menstrual cramps may continue after the procedure is completed and usually go away within 1 or 2 days. If the cramps feel slightly more uncomfortable for you, you can always take a simple painkiller to reduce the discomfort. After the procedure, you will be advised to avoid vigorous activity for a few days so as to prevent any shifting of the IUD. And that's it! You are all done! If you are considering getting an IUD but are unsure, do consider coming for a consultation at Ezra Clinic to find out more.